Welcome back to this teach out on gun violence. Hi, I'm Marc Zimmerman. I'm the Marshall Becker Collegiate Professor in the School of Public Health. I'm in the Department of Health Behavior Health Education. I also have appointments in psychology and the combined program in education and psychology here at the university. We actually don't have that much research on gun violence in the United States. There has been a somewhat moratorium on federal funding, and most of the funding that's happened in the last 30 years have been from foundations. So what we know is somewhat limited, but we do know some things. For example, we know that gun violence costs about over $200 billion a year in the United States based on medical, legal, and lost wages. It's estimates from sources at the Centers for Disease Control. We know that 8 children under the age of 18 die every day from gun violence. We can do better than that, for sure. We haven't really tested different strategies for what would be preventive. We have a limited amount of research on the epidemiology of the type of gun, how often it occurs with different kinds of guns and different situations in which it occurs. We hear a lot about mental health and the issues around mental health, and we do know that most people who have been diagnosed with a mental illness are not violent by far, that is not necessarily a risk factor. But we don't really have a lot of information about the different circumstances. And we're talking about gun violence is related to suicide, unintentional injury. While that is very small portion, we don't know the circumstances under which even an unintentional injury occurs. We don't know much about homicides. We know some of the characteristics of when and where it happens, but there's lots of information that we could get about the firearm itself, about the context in which firearms are used and fired, and when and where injuries, both morbidity, mortality, both injury and death occur from gun violence. What little data we have, we know, for example, that the rates of gun injury by rural and urban and suburban areas are basically the same for kids under 18 years old, that the mechanism is somewhat different. It's higher suicide in rural areas, and it's higher homicide in urban areas. It's about the same in suburban areas, but we don't know much beyond that. So what we really do is need an initiative, an effort for more research. We need to address gun violence the way we've addressed every other epidemic, every other source of injury. We just treat it as an injury like we've done elsewhere in the United States. And we talked earlier about cars. Car crashes were a major source of injury and death 30 or 40 years ago. And progressively, we've spent billions of dollars on improving car safety. We've done it at every level. We've helped train drivers to get better at it. We've developed safer cars. We have all the safety features in cars. We have improved the roads and the lighting of the roads. We have changed policies for graduated licenses because we knew epidemiologically that most of the serious injuries and deaths happen at younger ages. So if we helped train the kids better and had a graduated license, and we know all that because we made an investment, and we have dropped car injury and death significantly over the last 30 years. We took an investment, and nobody took away anybody's car. It wasn't about taking away the cars. And gun safety isn't about taking away anybody's guns. It's part of the fabric of the United States, and we're not taking people's guns away. We're trying to figure out ways and understanding ways where we can most effectively create safety, gun safety, firearm safety.